Welcome everyone to our training on how parents can support their kids with caring for their changing bodies, understanding privacy, setting boundaries, creating healthy relationships, and maintaining safety of their bodies. This is the second session of our parent series. But I am Allison Wiest. I am a parent trainer with Maine Parent Federation, and I am working alongside Lynette Johnson, who will introduce herself in a moment, to bring this training to you. We have had many families that have been interested in this topic, sexual health, and how to talk to their children about healthy bodies and puberty. So this has been a wonderful partnership to have with Lynette. I'll turn it over to Lynette to introduce herself today.
Yes, this is Lynette Johnson, and I am the director of our education programs at Maine Family Planning. In addition to having clinics around the state where we provide sexual and reproductive health services, our education team develops curricula and does trainings, both for parents, for educators, and other folks who are taking care or working with young people.
So this is our second, hopefully you've seen our first training. It was the introduction and stages of sexual development. The second webinar today or training today is regarding puberty and changing bodies and how to care for changing bodies. So we are excited to get started.
I can go over the objectives for today, which are pretty simple. We're going to just look at trying to repeat or do an overview of the body changes that come during puberty and helping our young people learn how to care for their bodies during puberty, which includes things like menstruation as well as um, um, spontaneous erections and things like that in boys, and to know the difference between public and private and what is acceptable in society for them and safe for them to do in public versus private. So for a quick overview, puberty begins, it's a wide range of when a young person might start experiencing puberty changes. And it's started off by, hormones in the pituitary gland, that start the changes of puberty. But all of the changes and the signs and things that happen during puberty can extend over quite a few years, and it can be faster for some kids, and it starts earlier for some kids and later for others, and it takes longer for others. So you probably have noticed that during this age group, at this age span, you see kids going through all different kinds of changes at different paces, and in different ways. So these are just some of the physical changes. They might get acne, body odor. You might notice more frequently. Their voices might change. Lots of cracking voices as they're talking, especially that happens with boys. But they also experience, emotional changes because of the hormones that are changing in their body. And they can get more moody. They can get a little bit more frustrated with their parents or things or their friends, in addition to the physical changes that are generally, talked about when we talk about puberty changes.
I can attest to what Lynette was just saying. My son is 13, and we are right in the middle of all of that. There have been some, for the last few years, there have been some bodily changes related to, odors and even pubic hair and things like that. But more recently, I have been experiencing the mood swings and the hormonal changes and the frustration that you mentioned with parents. So with his parents, so it is a real thing, and I think again for our kiddos, with neurodiversities that not having the understanding of what is happening to their body can be a challenge. And so I'm hoping that this training will be helpful as we go through the information. So again, with the changes that are happening, it's really important to understand how to care for our changing bodies. And again, I think with our kiddos, my son does enjoy showering, but I also talk with other families who their young person doesn't necessarily enjoy showering. So again, again, I think it for some kiddos it might be a transition for them to really understand that they need to take better care of their body. So one of those things would include showering more often. Um, Again, as I mentioned, my son loves to shower, so that's not a problem. Using deodorant, certainly there's, as Lynette mentioned, new body odors. As they're growing and changing and exercising, wanting to make sure that they're using deodorant on a daily basis. Wearing clean clothes, which seems, when I did up the slide, like, okay, we always change our clothes, but I also know that again, for some of our kiddos, that might not be an important thing to them. So, but making sure that they are make their clothes are getting into the laundry and that every day they're putting on clean clothes. And for females that might be developing breasts, that they begin to wear a bra, whether that's a sports bra or another type of bra that's comfortable for them. Combing hair and getting regular haircuts. Again, for some of our kiddos, getting a haircut can be challenging. I know for my son, it is. He does not like clippers or anything like that. But making sure that they're combing their hair every day, brushing their teeth, morning and night, keeping their teeth clean because that's an important part of just overall hygiene. Shaving can become a thing. It hasn't become a thing yet for my son, but again, they can start to, have hair on their face. And so I think shaving would be a big learning curve for him. So again, providing that direct instruction and support around doing that will be really key as they begin to get older and need to shave. And then appointments with medical professionals. And that might be around, obviously the body parts that we're talking about specifically, but then also just overall health, having those annual appointments with providers and having seeing dental providers on a regular basis, and even a counselor if there's some emotional or mental health needs or challenges. So again, that's all part of overall health. I think that it's really important and key for our kiddos to use those social stories. And we do have some, we're going to go through them in a little bit, but some social stories and visuals to really help support and teach our kids these skills. Also, just taking into an account that their fine motor, they might have some challenges with fine motor skills and really help them with some of those things. And then using reinforcements if needed. If they are, showering every day and being independent with brushing their teeth and combing their hair, recognizing that and rewarding them if needed for that. So these are some visuals that we got from the Vanderbilt curriculum. I think these are really great visuals actually, and we provided these, and I think we can provide them again. We'll post them along with these recorded trainings. But again, just some really nice visuals, really basic. And again, for a lot of our kiddos, I know for my son, just having those visuals helps him get through the steps. So again, these are some nice tools that you can use with your young person to help teach them and remind them of what they need to do on a regular basis to take care of their body. And I'm going to turn it over to Lynette.
One of the things that's important is that young people know the correct names of their body parts. And if you think about it, people have a lot of body parts that are similar to other people, like head, shoulders, noses, mouth, eyes, and we don't have a lot of nicknames for all those body parts. But when it comes to genitals, we seem to have a lot of nicknames, and sometimes it's easier for us in the society to use nicknames for a penis or for a vulva. And it's really important for that young people know the correct names of those body parts as well, even though they might hear from their friends or even at home, like other names for things that um, they might find funny, or some of them are more vulgar. They might hear those terms from friends at school or on the playground. And it's really important to say, oh, yes, I'm going to use one of those words. Yes, some people call that a dick, but it's a penis, so it's really important to give them the correct words, not only so they know their own body parts, but also because they don't use the wrong terms in the wrong situations. So you wouldn't want your child using some of those vulgar terms if they're talking about, with a family member that their, penis hurts, that my dick hurts, that sort of thing. So anatomy as well is both external and internal. And these might, like for instance, this is the external anatomy for most female bodies. And this might not be something that you are talking to your child about at a younger age or even during those younger puberty years, but generally this is when schools might be including anatomy, and if they're doing puberty education in schools, maybe in fifth grade, maybe sixth grade. It all depends on the school district. We've kept these diagrams pretty simple. They aren't very elaborate, even though we know that the body parts can be much more complicated. But these are some of the general terms and definitions that you could share with your child. Sometimes it's important for them to know both what the names of their body parts are and how that's different. Like if you're a boy, there's also girl body parts. And over time, you might want to help them use the correct language for body parts that, of the opposite sex.
I think I'll just say too, Lynette, that, again, I know in my experience, my son spends, a certain amount of time or, probably more time in the life skills classroom. And I think that there are some schools that those kids are not always getting the puberty training, which, again, they should be. My son has had some training, but or some education around it. So I do think it's really important to, this is a great training and resource for families. And so to utilize these diagrams and utilize this information with your young person who might not be getting that education in school.
And the internal anatomy might be something that most people might start talking about when you're talking about pregnancy prevention and understanding where menstruation, where the blood comes out of the vagina. So you might want to be familiar with these terms to share with your child if they have questions about how pregnancy happens and they're ready for a little bit more description about how the body works. And again, this is from our Puberty Happens curriculum, which you can find on our Maine Family Planning website, mainfamilyplanning.org. And if you go to for educators, you'll see puberty happens, and all of these diagrams you can look at and use if you would like. And there's some other, how to talk about puberty and that sort of thing. So feel free to access those resources. And male anatomy, again, here's some of the kind of more basic terms and definitions of the external body parts and internal body parts. And keeping it simple at this point, maybe later on in life, they're much more interested in biology. But at this point, it feels like these are some pretty basic body part names that you might want to go over with them.
Thanks, Lynette. So in thinking about menstruation, that is part of our changing bodies. We have some tips and strategies for, helping our young person understand what's happening. Lynette had mentioned certainly to use the correct names of anatomy. Um, it is important. I think, we all are guilty of it. I know I have been at times where, again, we don't use the appropriate term, and I feel like we still kind of use period and menstruation and whatever, but whenever possible, really using the appropriate terms for these things. I think also when I think about this, and I have a son, I have a daughter who's older, and so we did go through menstruation. It can be scary seeing blood for the first time, especially coming from an area that you didn't cut yourself or fall down and scrape your knee, and so it's coming from a different area. of your body can be scary. And oftentimes there's also pain associated with it. So it can be really be a scary time. So being understanding and patient, and again, explaining that, I think through all of this, um, it's normal. Like this is normal development. So normalizing everything that is happening, validating their feelings is really important as they're going through this. Um, Again, for our neuro diverse kiddos, there might be those sensory challenges. And so when we're thinking about what we're going to use to help with during the menstruation cycle, whether that's a sanitary napkin, or a lot of kiddos might be fearful of using a tampon because that's something that's inserted into their bodies, and so that might be scary, and that's okay. And there's other alternatives to that. Like I said, sanitary pads and napkins, a menstrual cup, and even wearing different underwear during that time period might be helpful and make them feel more comfortable. um I, Visuals, again, I use a lot of visuals with my son for a lot of different things whenever we're introducing something new or talking about something new. Just having those visuals, and you can have the sequence. And I think on the next slide I do have something, but a sequencing visual of what do we do first, what's next, and sort of those steps. Calendar reminders, I think, too, when they know that, when they're prepared, they know something's coming. So you're going to have your menstrual cycle every 28 days or in and around there. If it's on the calendar, they can expect it and then be better prepared for what might be happening. Um, Providing the opportunities to practice. Again, really key to know like how to deal. Certainly you don't want to wait until the first time, and maybe they're at school and they're not prepared and they're wearing something and they start bleeding into their clothes, and that's scary. And so just making sure that they have the opportunity to at least practice beforehand, again, know what to expect. Have a period plan. Again, like if we um, if we know that potentially we're going to be starting to have our period, or we know it's coming in a few days, that maybe we're wearing darker colored pants, and maybe we're even wearing like a liner or a pad or something in our underwear. Having the supplies, knowing where the supplies are at school, or having something in their backpack can be helpful. And then also just knowing that, again, it's an emotional time. There's a lot of hormones that are changing. It can be scary, as I mentioned, so they might be more emotional than normal. And again, providing that support and reassurance that this is normal development, and giving them the tools to help them through it will make it a little bit easier, hopefully. So this is a printable visual poster, or just a sequencing visual that you can use and post it if you need to in the bathroom, or just have it available for them, laminated or something like that. But it's again, a nice visual for kids who need that, especially in the beginning. And again, maybe once they get more comfortable with how to manage having their menstrual cycles, they won't need a visual anymore, but it's a good place to start, I think. And then also we have a social story here. It's just an example of some language that can be used. If you've ever had social stories for your young person before, or ever made them, you can make them in a lot of different ways, but this is just some language that you can use. And again, in this particular one, it says period. You could use period, or you could use menstrual cycle or something like that. But it helps them to know what to expect, and they can read through it themselves. You can read it together. It's again a nice sort of, it lays out what to expect with blood coming from the vagina, and again, sort of what you can, your clothes might get stained, and so we want to make sure that we're wearing a pad so that we don't stain our clothes. And period comes every 28 days. It might be sooner or later. That's okay. So there's a lot of reinforcement about that it's normal and it's okay. it talks a little bit about pain, and sometimes that might be, their stomach. It also might be in their breast. It also might be in their lower back. And again, that is all considered normal. Talking about a heating pad to help to relieve some of that pain. Also, something like Motrin or something could be helpful. And then how long the period lasts. It might be longer, it might be shorter. So again, this is just a nice little tool that you could use. Lynette, did you want to say anything about menstrual cycles before I move on?
I think just to let information beforehand is usually better than too late. So however you might feel it's appropriate to bring that up with your young person, that this could happen with them, and not to be scared. Because I think it can be scary if someone doesn't know that, if they're bleeding and they don't know in their underpants, and they get kind of concerned. Just letting them know in advance, your body's going to start changing. And here's one thing that you might want to, watch out for, and it's normal, but you should definitely come and talk to me if you notice that you have some stains or, some blood in your underwear, because it's probably that you started your period. And then letting other people know who, like where they spend their day, or if on the weekends or in evenings they're with a caregiver or a family member, letting that person know, and also making sure they have supplies at their house, because maybe they're period will start when they're staying overnight with grandma and grandpa, or if they're at school. So just usually school nurses have all of those supplies. So letting your child know that those supplies are available at school. If your child does start their period, you might want to let, their classroom teacher, if, they've built a relationship with them, like to know, like, this is happening. And so um, just to let you know, so it's not a surprise. And that when young people start their periods, it can often be irregular for quite a while because the body hormones are still changing. And so it's sometimes not that easy to predict. And it could be that they go longer than a typical month, between periods, or maybe they have spotting in between. So it's really normal for those first few months to be a little bit irregular, or maybe even the first year to be irregular. And then they might have some of those symptoms of, cramps and need a heating pad. And so if you notice anything that seems particularly concerning to your child or to you, then definitely talk to their, doctor about it. Because many of these things are normal, but how they can be managed, the doctor might know your child well enough to know what's going to work and what's not going to work, and what's going to be more comfortable for them.
Thanks, Lynette. So now we're going to switch over and talk about tips and strategies for spontaneous erections. Again, normalizing this. It is part of human development and is a healthy experience for the penis to become hard and longer. And it can happen suddenly. And sometimes, again, my son, I don't know that he always gets embarrassed. He's not somebody that typically gets embarrassed, but it can be an embarrassing thing for some kiddos. And so having them, kind of preparing them in advance, as Lynette was talking about, knowing what to expect, that this is something that could happen when your body is changing. It's a normal part of development is really important. So again, just being having those proactive strategies and letting them know before something like that happens, so that they're not concerned or worried. Some ideas would be wearing different types of pants, wearing maybe jeans or something like that, hides, an erection versus wearing maybe sweatpants or something like that. So maybe they might start, wearing some different clothing if they are a kiddo that, because I do know my son, and I know a lot of kiddos that like sort of those exercise shorts or athletic shorts or athletic pants and things like that, because they're comfortable, right? But again, finding something if you're noticing that they're starting to have more erections, and it is, happening more often and they're embarrassed by it, they can be wearing something different. The other thing too, is just wearing maybe a longer shirt. And again, a longer short can sort of help cover that area as well. Um, Fidgets or other replacement behaviors if it's distracting. So, I will share that my son has started having more erections. That is something new that has happened in the last few months. And so, he did go through a phase when he was younger where, he was putting his hands down his pants, um, at various times. It was almost like a self-soothing behavior. And so we had to have a lot of dialogue around, public versus private, which we'll talk about a little bit later on. Um, but again, it was more of a soothing. My point being, it was more of a soothing thing for him, and so it can be distracting or it can be soothing, and so giving them something else, like a fidget or a different behavior, so that they're not touching their penis or putting their hands down their pants in public places might be helpful. Teaching strategies for those unexpected and unwanted erections. And, we have some things laid out here, covering the erections with an object. So again, if they're in a place where it just happens and they're not expecting it, again, that could be concerning for them. And so I don't know, maybe they put up, if they're at school, maybe they just put their book in their lap, or if they're standing up at school, maybe they sit down. If it become, again, if it's pretty uncomfortable for them, they can ask, right, to be excused. I need to go to the bathroom, and can I, excuse myself to go to a private place. And I think, you know, as you're having these conversations, like giving them the language or the scripts of how to ask for these things. So, if you are having an erection at school, these are some of the things that you can ask for, or some of the things that you can do. Again, if you notice that your penis gets hard, you can ask your teacher, "Can I go to the bathroom?" And then once it sort of subsides, maybe you go back to the classroom or something like that. And then rewarding them for, again, if they're using these strategies, rewarding them for the use of those strategies. Lynette, did you want to say anything more about that, or
I don't think so. I mean,
okay.
I think one thing that pops in my head though is that during puberty that and the changes that are happening differently for different kids, there can be a lot of teasing as well. Like maybe someone is stinkier than they were, and so then the kids call them stinky, or point out the fact that they don't smell good, or might laugh at them if something happens. And I think it's just important to let our kids know that everybody's changing at different in different ways, and it's all pretty normal, but it's not good to tease somebody if they notice any of these things happening, or it's not okay to be teased either. So I know it's hard to prevent that, but it's important for and if you notice that in your child's school or something, if the staff aren't really doing anything, and your child feels like they're being picked on because of going through some of these changes, you might want to address that with the teachers.
I think, and we went through a similar thing, again, like I mentioned a few years back when he was putting his hands down his pants, and there was a neurotypical kid that was sitting next to him and noticed he had done it and was like, "Oh, that's gross," and so sort of called him out on that. And so, again, that was, the ed tech handled it appropriately and all of that. But again, teaching him, because he doesn't really understand those social norms, and it was just, he might have been anxious because he's dealing with anxiety and he's in the classroom. And so it was just sort of, that self-soothing thing that he was doing. But again, giving him an alternative to soothe himself while he is in the classroom, and then letting him know. And again, we'll talk about that in a little bit, that, a private place is a place where you can, touch your penis in your bedroom, behind the door, in your bed, those kinds of things. But we'll talk about that. Um, so nocturnal emissions, again, normal part of development. It's can sometimes happen without, parents knowing. The kids don't know that it's, even happening. And so, having some language to sort of help explain it. Oftentimes we hear it referred to as a wet dream. But when I'm sleeping, I might have a dream. When I wake up, my sheets might be sticking wet. This is called a wet dream. When I have a wet dream, I should wash my testicles and penis when I wake up, and wet dreams happen to many boys. So again, when they wake up, like, you know, cleaning that area, taking care of their body. But again, just normalizing it that it is okay. It seems different and it might feel weird to them and they might not understand it. But again, I think having conversations about it and normalizing it is really important. Also, just teaching them how to sort of address it and care for it when it happens. And maybe that means having a visual schedule if needed. But, when they wake up in the morning, having them be a part of like taking the sheets off their bed and putting the sheets in the hamper, or maybe even in the washer if that's something that they are able to do. And then once their laundry or their sheets are clean, that they participate in making their bed, and they can get help from a parent or a caregiver if needed. So just having them be part of the process of caring for something like that. But again, also just normalizing and having those ongoing conversations is important.
I think as an adult, sometimes we sexualize like, masturbation or erections and nocturnal emissions. And certainly it could be as they get older and they starting to have sexual feelings, if they see a picture or if they, find someone attractive, it's, that is part of growing up. And sometimes the spontaneous stuff has nothing really to do with like, oh, he must have been thinking about sex. Oh, he must be thinking about sex. It's like that's probably not what's happening during this part of their development. It's just their body responding to whatever
The
might,
changes that are
yeah.
happening with that. Yes. Thanks, Lynette. So I talked a little bit about this, touching their genitals, masturbation, and ejaculation. Again, exploration and touching of your personal sexual parts is normal behavior, for both boys and for girls. Um, it's really important, however, to teach them like when and where it can be done, so that private versus public. Um, for our kiddos, it is, a little bit more of a challenge because those social norms aren't automatic. Those need to be taught. So that's why it is really important for us as parents to make sure that we're educating them on, public places and private places. And we're going to talk about that in a minute. But having it can be hard to have the difficult conversations. And again, as Lynette was saying, like I feel like depending on, what era we grew up in or something like that, like, oh, talking about masturbation is feels uncomfortable, but we have to have those maybe uncomfortable or difficult conversations with our young person so they know what to expect and they're better prepared. And but I think there are also a lot of tools, social stories, visuals, books, videos. There's a lot of information out there that can reinforce, what we're trying to teach them. Um, Always, making sure that we're using, simple language with them, a level that they can understand. And then also, making sure our conversations are shame-free. We never want our young person to have any shame about um, what they're experiencing or what they're telling us or anything like that. So just keeping it simple and shame-free is important. Um, Again, if it's a problematic behavior that is happening, again, I'll just go back to the scenario that I gave before. Touching your penis in school is not okay. And so providing redirection or fidgets or whatever it might be to to remove that behavior or give them something else to focus on can be really helpful. So public versus private, again, a really important concept for, again, depending on the development of your child. For my son, I mean, he's getting it and we've talked about it a lot, but there's still times where it's just not an automatic thing that he needs reminders. But a private place is where no one can see you or also just walk in. So even though, our homes might seem private. Our living room seems private. It's not private if somebody else in the home can just walk in. The bedroom with the door closed, your own bedroom with the door closed, that would be considered a private place. So, private place is where no one can see you or just walk in, and a public place is a place anyone can go. So, um, I think that that's, you know, providing different sort of scenarios like oh, when you're at the movie theater or something and we're watching, a Disney movie. I'll just use that because that's what we do, but we're watching a Disney movie, even though like we might be the only one in the movie theater, or maybe there's one person way down in the front and we're way in the back, and it seems like we're kind of alone. It's still a public place where anybody can walk in at any time and see what we're doing. So, using that language, public versus private, ongoing. And I'm trying to do that more in my home. The bathroom, my son is still, he's better, but he's still not great about always shutting the door. The bathroom is a private place when you're, whatever you're doing in there, if you're going to the bathroom, the door should be shut. Um, and taking those opportunities in sort of our natural events of the day to reinforce that concept of public versus private. Um, my son doesn't really go into to the stores and try on clothes. I typically buy clothes and bring them home, and then he tries them on. But again, there's certainly times throughout our normal days when we can practice this. As I mentioned, setting up those privacy boundaries at home, and then just reiterating and reminding them private behaviors only in private places. And I think the next slide talks a little bit more about that. So this slide is like what is not okay to talk about or do in public. I think it's also important to talk about what you can do. So again, sort of giving the differences, but and this isn't a comprehensive list, but an idea of some of the things that is helpful to share that we don't talk about in public. Certainly our private body parts or bodily functions. When we're thinking about private body parts, a good way to explain it is, what are the body parts that are underneath your bathing suit? So again, those are the things that we don't talk about, and the functions of those body parts we don't talk about in public. Private behaviors, whatever, again, our kiddos might not be talking about sex, or they might have heard something and it's funny, but we don't talk about those things when we're in public. Sharing personal information. Again, our kiddos might not have the understanding of vulnerability or safety, and so they freely might say where they live and things like that, give someone their address. So again, really having those conversations with them about not sharing your personal information with somebody in public is just a good reminder. Long kisses, in public, we're not, kissing somebody for a long time. I know, in our country, I think there is sort of a lot of like, oh, you might kiss somebody on the forehead or you give somebody a hug and you might on the cheek or whatever, but long kisses and things like that are not something that we would do in public places. That's for in a private space. Um, undressing, again, thinking about maybe they are in the locker room. But and some, I mean, I think this one is a little bit challenging when we talk about locker rooms because I do think like older kids, um, change, openly in front of each other. But depending on your own family values and things like that, I think it's important. Like it's okay if you're not comfortable to do that, be in that setting, that you go in the stall where there's the curtain or something like that. That would be more of a private place to dress and undress. Showering and bathing, that's not something we do in public. We do that in private. Included picking your nose. Again, I think, and I'll catch my son doing every now and then, picking his nose or putting his finger in his nose. I see adults doing it, to be honest with you, but we don't, we wouldn't typically pick our nose. We can get a tissue. My son was a little sniffly this morning, so I'm like, oh, make sure you ask for a tissue or you go get a tissue if you need it. So again, just reminding them of that. Certainly touching and scratching their sexual body parts that we talked about. And again, I think I already said this, a good way of reminding them of what is a private body part is what is covered under your swimsuit.
I was thinking of how, like, you might say a bathroom is private, but then if you're at the bathroom at the movie theater, so you
Right.
might, every situation, you might have to, clarify, like in this situation, it is a bathroom and those are generally private, or a stall is private, but then people can also come in and out of the bathroom, or
Right.
if you're at a friend's house and maybe they have a private bedroom, but like that's their private space. It doesn't mean that it's a private space for you necessarily. So I think
Yes.
all the different situations, just repeating it, and I
Yes.
can understand how that can be misunderstood.
Hmm. Yeah. Having a variety of scenarios, I think, is really important. Um, oh, and then it's also important to share, and I already said
Mm.
this, and reinforce what is okay to talk about or do in public. So, some strategies and tips for parents, have your child, sort some cards. There are, this resource that is pictured here is through Mad Hatter Wellness. It's a flip chart, and I've used it quite a bit with my son, actually. I think it's a really nicely done resource, but it gives like, okay, is this behavior, okay in a public place or so on, or somebody, it'll give a scenario. Your friend gives you a hug at school. Is that, so again, it's starting to think about like, things that we do in public versus things that we do in private. And I think too, I've seen, just cards like flashcards and stuff where you could make your own, where you sort of sort through some of those things with your child. Coloring body parts, a coloring page, and talking about sort of what are the private body parts, making a collage of public places, and then making on the other side, you're making um, a collage of private places to sort of reinforce what's public and what's private. And that, as Lynette mentioned, it would, open up a whole conversation um, about public versus private. Role playing and providing scenarios, I think that's a great way to teach it because, again, there is a lot of as Lynette mentioned, like, okay, a bathroom might seem private, but in a public place, it's a public bathroom. So when you go into the bathroom, that's a public bathroom. When you go behind the stall, it's a little bit more private, but there's still people in there just outside the door. So again, just a lot of conversation. Consider how you and others close to your child would respond if they made a mistake. So again, I think just, reinforcing what the correct thing is, not shaming them for making a mistake, but just sort of using that as another opportunity for education, and then rewarding them for their, successful, use of these strategies. And here are some resources that we talked about. So the flip cards on the last slide, as I had mentioned, are through Mad Hatter Wellness. They have some really nice um, visuals and aids and things that you can use with your young person. They have a whole curriculum too. Um, Vanderbilt University has their Healthy Bodies Toolkit. They have a workbook or a booklet for boys as well as for girls. And then, as Lynette mentioned, family planning, they have their Puberty Happens curriculum as well. So there's a lot of great resources out there that can help reinforce and support parents as they're trying to talk with their child and support their child through this transition. Lynette, did you have
Yes.
anything else you wanted to add?
We have some of the flip cards, and we have some of the Healthy Bodies booklets, both for boys and girls. There's a set for girls, which includes like just general information, but then also diagrams like body parts and social stories, or how to use a pad and that sort of thing. So we don't have, at the beginning we had our emails, but you can definitely reach out to us. education at Maine Family Planning, and I'm sure you know Allison, how to reach Allison. Or if these are links on this particular slide that you can't click on because you're viewing this, but if you just generally type in Mad Hatter Wellness, flip cards, it will, I'm sure, bring you to that website. Same thing with the Vanderbilt Healthy Bodies Toolkits and Maine Family Planning Puberty Happens curriculum. So if you just Google some of those or whatever search engine you use, I'm sure you'll be able to find those resources, but certainly reach out to us.
Great. And thank you for being with us. We have three more trainings to provide. So we will see you on the next one.
Thank you for joining.
Thanks, everybody.